Okay. Well, hello there, everyone. Welcome. This is Dr. Leslie Kernisan of Better Health While Aging, and also the Helping Older Parents membership. Welcome to today's Challenges with Aging Parents Q&A um, call today. So thank you for signing up. Thank you for being here. And I am excited to be here to answer your questions, but I'm especially excited because today I get to do it in one of my favorite ways, which is in a combination tandem with one of my favorite colleagues, which is Michelle Allen, who is here as well. So Michelle, do you want to introduce yourself really briefly?
Hello, everybody. My name is Michelle. I am a licensed clinical social worker working as a geriatric care manager or an aging life care professional in the metro Atlanta area of Georgia.
Yeah. And Michelle is also our lead geriatric care manager for the Helping Older Parents membership as well. Also, here with us today, providing extra assistance and support in the chat is Carol Bradley Bursack. She is an elder care expert in her own right. She has a journalism background, but also has cared for several aging family members herself, wrote a book called Minding Our Elders, has made this the focus of her journalism and writing for quite a long time. And we are very lucky to have her as our community moderator in the Helping Older Parents membership. So today we're going to be doing your questions. And the way I'm going to do questions is I am going to take questions that are posted in the Q&A box. So if you look around on Zoom, there should be a spot that says Q&A. And go ahead and put any questions that you have for me and Michelle in the Q&A box. You're also welcome to participate in the chat, share reflections. It's just the chat tends to go by so fast that Michelle and I can't track questions there. And if you want to participate in the chat, I recommend making sure it's set to share what you put in the chat with everyone, not just the hosts and panelists. And then while I'm waiting for some people to submit questions, um, I'm just going to say a few words about the membership while we are here. What is the membership? So this call today is actually in a way like me deciding to extend what we do in the membership to a larger group of people. Both Michelle and I and Carol feel very strongly about wanting to support people like you who are on this journey of helping a declining older person. It's our work, and we also would not be able to do our work if it weren't for the collaborations that we have with family members and concerned people. So I do like doing free Q&A calls, and a while back I felt like I would really like to offer something more substantial to support people. And so I created the membership in 2019. I am very lucky to have had Michelle and Carol helping me with it since that time. So what it is it's an online group program in which I and professional care managers, especially Michelle, and we have a few others who support us as well. We provide family members, adult children, sometimes spouses, with ongoing guidance, direction, support, resources, and coaching. And there are three pillars to the membership. We do weekly Q&A calls. Now, those weekly calls are a little bit different from what we're doing today because we have a pretty big group today. We're probably not going to be able to unmute people, but for our weekly Helping Older Parents calls, we can unmute people and go back and forth and talk with them. And that's really helpful. That's helpful to us to better understand the situation and provide advice and guidance. And it's helpful to members as well. So we do weekly calls, either me or Michelle. So this kind of aging parent QA is special because you get both of us at the same time. I also have two Helping Older Parents courses, one that's especially focused on memory loss, dealing with a parent with memory loss, another one that covers kind of more basics about helping an aging parent through this stage of life. And then we have a private online community, which is great because members can at any time get support from each other. Carol does an amazing job moderating and providing support, and then Michelle and I also come in and answer questions as well. So it means that members don't have to wait for a weekly call to get our guidance. So I'm going to stop talking about it now. I am going to send more information about it today along with the replay. There's also a link here if you want to learn more about it. So you are welcome to check it out. If you don't want to get messages telling you about the membership and giving you the opportunity to get that support and guidance from me and Michelle, there's a little link at the bottom of the emails that you can click that will stop getting those messages. It won't totally unsubscribe you from Better Health While Aging. And with that, we're now going to go into the questions and answers. So we have a nice sized group of people, and we already have several questions. Hello to everybody. So I'm going to start doing answering some questions that are in the Q&A. And again, please, many of you actually responded to the Google form, the survey. Thank you so much. I read through them. It was really helpful to learn more about what kinds of issues you have been on your mind. And even if you ask a question there, please ask it here in the Q&A so that Michelle and I can address it. And here, this is me serving as an educator. I am a board certified geriatrician. And the more details you provide in your question, the more I can give you detailed information on how I would handle it as a geriatrician, or we can get a lot of advice from Michelle as well. So, all right, Michelle, let's start going through some of these questions. So, Jenny asked, any suggestions on how to respond when your elder gets confused and thinks they are not home? My mother is blind. Okay, so my question for you, Jenny, would be first and foremost, how old is your mom? But especially, does she have cognitive impairments? Right? And I don't know if that's something that you can tell us in the chat. We'll see if Jenny like adds a little bit in the chat or not. But maybe, Michelle, while we wait for that, this is a very common issue that comes up with older adults, especially if they have developed some memory loss or thinking problems. Maybe they have a diagnosis such as Alzheimer's or dementia. Sometimes people have not been diagnosed, actually, for various reasons. But especially in people who are experiencing memory loss and thinking problems to the point at which it would qualify for Alzheimer's. Or a dementia diagnosis, it's pretty common for them to get confused and feel like they might not be home. So, Michelle, can you talk a little bit about what you found is helpful for older adults?
Yeah, I think the first thing to do is to get really curious and to have like a very calm demeanor and say like, "Oh, where do you think that we are?" Because doing that reality orientation or trying to reconfirm back to somebody that they are at home and to be kind of challenging what they're confused about can sometimes make things worse. So I think sometimes it's helpful to be really reassuring, but also just to get really curious, like, oh, where do you think we are? Kind of smells like our house, or, like it seems really familiar to me. Do you see anything that's familiar? And maybe ask some questions to get the person talking and maybe start offering some reassurance. I think our
Mhm.
I think it also depends on how distressing it is to people. Like I often have clients who are confused about where they are, but they're just more curious. They're more like, where am I? Like why last week I had a client that was convinced she was in that dead lady's apartment. I don't know who that dead lady was, but she was convinced that she was there in her apartment, but she wasn't upset about it. She just was like, I'm in that dead lady's apartment. I don't know why I'm here. I was like, okay, well, you ready to go to dinner? Let's go to dinner. And then she was fine.
Yeah. Yeah. I agree with what you're saying, Michelle. And I think you're getting at a couple of things. So often it takes some time to learn how to interact more constructively with a parent who's having some memory loss or thinking problems. And people do initially tend to want to really like reorient them to reality. And we do find that often that does not work. And that really meeting them where they are and trying to better understand their their understanding of what's going on and what might be bothering them or driving them, and then speaking to that and trying to find a sort of more trying to find what is the thing that might be reassuring. But what tends to not be reassuring and tends to be very irritating to lots of older people, it's to be told that they're wrong and to just get an explanation.
That's
Like you're home, everything's fine. It
mm-hmm.
feels unsatisfying and unvalidating to them. And so that gentle curiosity, and then thinking also to what might be the underlying emotional need and what might be something reassuring,
Mm-hmm.
you know? And maybe it is gently saying, I think actually this is home, but it looks a little different right now. We change a few things up.
Mm-hmm.
That just happens,
Yeah.
right?
Yeah.
I've also been thinking it doesn't feel quite the same, right? Something that reassures and normalizes the feeling that the older person has of discomfort. And then what is something that's going to help them feel secure and cared for and loved? Something kind of affectionate. So Jenny said, we have not had her tested because we figure there's nothing that can be done, but she has kind of decline. Yeah, um, I actually have a YouTube video on the Helping Older Parents channel about this, the benefits of getting the evaluation. Um, it's true that not everybody has to go through the complete evaluation. I personally like for people to go through it because they may have another medical problem or maybe a medication that's making them otherwise worse. Jenny said her mom's 95. It's pretty rare at that age for us to find that actually all of the confusion is due to a reversible medical problem. That's very rare, but we do sometimes find that there are things going on that if we make some adjustments, we can help the person think a little better. And we are often trying to help people think the best they can. Another advantage to, some other advantages to getting the evaluation is one, it helps the doctors know that this person actually has a real cognitive limitation, needs other people involved in their care, their decision making, maybe needs their medical care simplified. And it also sometimes is helpful for families to sort of realize that, okay, there really is something here, and we might have to step in and override a little bit more as well. So, on the flip side, it can be really hard to get a person evaluated. It can be hard if they don't want to go. It can be hard if you're having trouble accessing the right kind of specialist. So I think it's definitely reasonable to ask yourself, is this worth it? Is this where we want to put the efforts that we have? Okay, thanks for that question, Jenny. And maybe I'll stop the share just so that everyone can see me and Michelle a little better. Okay, so next question. Amy asks, when my parent goes to the doctor does a memory test consisting of 3 questions. The questions are asked at the beginning of the appointment, and then they ask for the answers again a few minutes later. It feels like this is not an adequate memory test. Do you suggest this method or a different approach to evaluate memory? All right. Yeah, I'm happy to speak to this to start off. I agree that that sounds like what's called the 3-item recall. Actually, I'm not sure because they're saying 3 questions. A 3-item recall is usually, I'm going to tell you 3 words. I want you to say them back to me. I'm going to ask you again in a little bit. So you give the person three words to remember: apple, penny, chair, and then you ask them again later on. In of itself, that doesn't sound like a memory test that, it's usually more like a component. There is something called the mini cog, which actually has been studied and has been like fairly validated. And with that, there is a 3-item recall, but you also ask the person to draw a clock with the hands in a specific position. I think it's supposed to be 10 past 11. I often do 11:15 because really, if they start trying to write a 15 or looking for a 15, it's clear that they're like very lost. So I partly wonder, in terms of Amy's question, are they also doing the clock? But the 3-item recall is really just about short-term memory, and often there are other sort of significant things going on. So drawing a clock, putting all the numbers, and putting the hands in the correct spot does actually take a fair amount of mental coordination and executive function. Um, and so I would say that's a better test, but really what's especially useful is for the providers to ask, what is this person having difficulty with? And to ask a family member as well, because often an older person is not a reliable reporter of what they are having difficulty with. I have an article on better health while aging, how we diagnose dementia. I think that lists some of the memory tests, but if there's more time, the MOCA test, but that, especially with somebody who's having some memory issues, that can take like 20 minutes to do. That's like a whole visit. There's another one called SLUMS. Mini mental is an older one. Is there another one that you can think of, Michelle, that you are often using yourself with clients or that you see doctors using?
The mocha is always my go-to. I think that's the best one. And what I see doctors doing what Amy's describing.
Hmm. Yeah. Yeah. They're often kind of cutting corners, and that's part of why I have a couple articles on better health while aging. It's also in my book, When Your Aging Parent Needs Help. I forgot to bring the copy. But there are links to that on the website, of checklists of things that ideally they would do to evaluate somebody who's having memory difficulties. So Lori Carpenter said MOCA test. It's MOCA actually, and it stands for Montreal Cognitive Assessment Test. Teresa said the 3-item recall and drawing the clock occurs every year at my routine wellness check. Well, that's good. But ideally, they're also asking, are you having any difficulties with things that you weren't having difficulty with before, right? Because usually, if it's cognitive issues, we start seeing difficulties, finances, driving, complex things, planning complex things, right? Like meals or vacations. Um, or people might be having limitations physically, right? And it's important for the health providers to become aware of that so that they can assist with that as well. So that's what I think ideally they would do. Okay, thanks for the question. Anonymous says, do you have any tips for my sister-in-law who has dementia about hygiene, like taking a shower, brushing teeth in a nice way that doesn't sound like nagging? Um, Yeah. So, Michelle, maybe you can speak to this one. And meanwhile, Anonymous, you didn't put your name, but if you can share in the chat, I'm curious whether who your sister-in-law is living with. Is this somebody who's living alone with dementia, or are they living with somebody, and who is that someone? Because it does matter whether we're trying to come up with something that can prompt the person on their own versus support a family member or even paid caregiver in getting this done. But yeah, what would you suggest, Michelle?
I think that you're spot on that we do kind of need to know more about what does the whole support system look like. Um, but I think in general, what I would say is that we've got to start thinking about ways to help support that person's decline in executive functioning. So we can't just assume or expect that anybody with dementia, if you just tell them to do it or give them a checklist, that they're going to be able to follow through on that. There's a lot of barriers going on in their brains that keep them from going from like wanting to do the action to actually being able to carry out the action. So what can we do to help change that in the environment? And so if your sister-in-law is living with somebody, instead of telling her it's time to brush her teeth, maybe go ahead and put the toothpaste on the toothbrush and hand it to her. When it's time to take a shower, just go ahead and turn on the shower and be like, okay, it's time for us to get in the shower. Other thing to think about when it comes to hygiene, especially bathing, is that getting into a shower or getting into a tub can be a very scary thing for somebody who's got so many changes happening in their brain. Like they got depth perception and visual changes. They don't understand what's going on sometimes. So oftentimes, we have to kind of give up on a traditional shower and think about how do we get this person clean in a way that matters, and keeps them like clean enough and safe enough without maybe immersing them into a shower or into a tub. But we do have to get pretty creative on how to make that happen. But I think moving your question about making it where you're not turning into nagging, maybe I would say move away from words and move more towards action. So handing her the toothbrush with the toothpaste on it, turning on the water and handing her a towel and saying, okay, it's time to have this, it's Tuesday at 4 o'clock. It's time to take our shower. Or, we're about to leave to go out to dinner. It's time to take a shower and
Yeah.
start making some action that way.
So Michelle, um, I think the question was from Pat, who said, my sister-in-law is living alone.
Okay.
And so, yeah, I definitely want to hear your thoughts. I mean, I find when people are living alone, I mean, you can try very frequent reminders, sometimes written, posted reminders, maybe
Mhm.
might help. Some families end up like calling a lot, providing the verbal reminder. Some people for their parents end up putting cameras or have devices through which they can speak. But often living alone long term isn't viable. But why don't you share your thoughts, Michelle?
That's exactly what I'm thinking too. If she's living alone and some of these things are slipping, it makes me think, well, what else is slipping that she might need support with? Like, is she managing her medications? Would she know what to do if there was an emergency, like a fire in her house? Like, maybe there's some other red flags that can indicate that maybe it's not time, maybe it's no longer safe for her to live at home alone, and we need to put some more supports in there, start thinking about a move to an assisted living community so that she can get some more support.
Yeah, yeah. And in general, in most cases, at some point, um, unless they die of something other than their dementia, of an illness or something, but um, as dementia progresses, it's not possible to keep living alone. So people either need to have someone in the house with them eventually, most days, and then kind of all the time, or they have to move, right?
That's right. Yeah.
Yeah. So now is not necessarily the time to move her, but it can take a while to even figure out, well, like, what would the options be, right, for providing that next level of care? And that is something that that can take a while to figure out. And we actually have a video about the cost of elder care and options. That one's on the Better Health While Aging channel because I haven't yet made a version for the Helping Older Parents channel, which is newer. And you can't on YouTube post the same video on like two channels. But thanks for the question. That's a good question, Pat. Okay. Lily said, how can we arrange for care at home instead of going to a facility? I have my own home. I am early stage dementia. Can my daughter be paid to care for me? How? I have Medicare and a supplement. Well, Michelle, let me turn that one to you.
Yeah, so a lot of people do want to age in place at home. So they want to stay in their home and avoid moving into an assisted living community or, a small group home situation. And most people especially want to avoid nursing home care. So when we start thinking about needing more care, we do start thinking about having care come into the home. And usually the first thing we think about is who's in our family that maybe could help provide some extra support. Um, Lily, you have a great question about how do you pay for that. So it sounds like you have a daughter who might be available or willing to help provide you with some care and support. And you mentioned that you have Medicare and a supplement. Now, as things are currently in our Medicare world, Medicare doesn't really pay for much in the way of long-term care. So it doesn't really cover for to Medicare doesn't really cover to pay for caregivers to come in the home and provide any support, whether they're related to you or not. There are some Medicare Advantage plans that are starting to offer some home care benefits. The home care benefits are not really enough to help support people at home in a very substantial way. So basically, Medicare is not going to help pay for any kind of caregiver, you know, family member or private caregiver. But if you are eligible for Medicaid, and every state has different laws and different regulations on how Medicaid works in their states. But a lot of states do have a self-directed care waiver kind of program that you can use your Medicaid dollars to pay for a caregiver that you choose to come into your home and help provide some care and support. So Lil, there's a chance that if you're eligible for Medicaid, that potentially there could be a Medicaid program in your state that could help pay for your daughter to provide you with some support.
Yeah. I think some other options that just occurred to me is if you are not yet eligible for Medicaid, having you can create a contract with a family member so that you pay them for the care because once people go on Medicaid, they do look at like where how you spent your money, and if you gave a lot of money to a family member, that's can be problematic because you're basically not supposed to give away all your money to your family and then say, I have no money, I'm on Medicaid.
Mhm.
However, if it's a contract, then it's legitimate for you to actually pay for care. And families sometimes don't realize this. Sometimes adult children spend years providing quite a lot of care. It's unpaid, and then they'd like to get on Medicaid, but at that point, you can't just shift like a big chunk of money that
Mhm.
reflects like all the time that you spent over the previous 3 years caring for someone. So that was one thing that that kind of occurred to me. And then some long-term care policies kick in and start paying for care
Mhm.
if people have dementia. I don't know if they ever pay family members, though. Do you know, Michelle?
Okay, so most long-term care insurance policies, we have to really look at how what the policy, how it's written. But some long-term care insurance policies do allow you to hire your own caregiver, let a caregiver who's not through an agency and pay them. And some do have the ability for you to pay for a family member. But I would say most of those policies that allow you to find your own private caregiver, most of those policies do have an exclusion where it can't be a family unless the family is providing some level of specialized services.
Mm. Okay.
But I would say it's very rare.
Yeah.
But you could also
Uh,
use VA benefit money. So if you are eligible for the VA aid and attendance benefit, you could use that money to then pay somebody through a caregiver contract, just like you had mentioned. So that could be an option as well, though, if you're a wartime veteran or the surviving spouse of a wartime veteran.
mm-hmm. Yeah, and some other thoughts for Lily, or Lil, I'm not sure. Um, One is you can look for support groups for people who are early stage dementia near you, because I think this is something that comes up for a lot of people.
Mhm.
And that's like a place to get, have support and sharing ideas about thinking about the future. I think it's great that you're thinking about the future. Right now, not everybody who has early dementia does.
Mhm.
And then, yeah, we do have this video where we go through different options for elder care and how they get paid for, and that might be helpful to you and your family as well. Thanks for the question. Okay, Beverly said, my two siblings and I need help with dealing with hesitant aging parents who need care beyond what is available in the rural area. My father has remarried following the passing of my mother in 2003. They've been married nearly 20 years now. His wife is dealing with increasing dementia, no diagnosis yet. What can we do to keep our father protected financially and medically in such a situation? Oh, wow. Uh, all right, Michelle. I'll um I'll turn
So
this one to you,
yeah, I'm
actually.
trying to think this through. So Beverly, I wonder if what you're worried about is that your father's new wife is having, she has dementia, so we expect that she's going to have an increasing level of care needs, which can be very expensive. So it sounds like one question that you might be wondering about is how do we get her the care she needs without impoverishing your father? Because maybe he never really meant for his finances to support his new wife, or maybe he does want his finances to support his new wife and her increasing care needs. One thing that I
She's
think
a
might be,
second wife. They've been together 20 years, but yeah.
yeah.
But I see what you mean, though. Yeah.
And so one thing that I think about is it might be worthwhile in this situation, Beverly, for you and your father and your siblings to meet with an elder law attorney. So we do have specialized attorneys that practice with like helping people make these kind of decisions and sort through these kinds of situations. And there's even certified elder law attorneys. So you can look in your area or somewhere close to your father to find a certified elder law attorney who might be able to sit down and have some of these conversations. Because I promise you, if they're a certified elder law attorney, they've seen all the ways that this could go. and would have some advice on how to help protect him financially, or at least facilitate a conversation with you and him and your siblings about how he wants his money spent. Because maybe, you know, I don't know what your father's feelings might be about any of this, but I could see where you're concerned and how you want to make sure that everything's protected and happens the way that he might want it to go.
Mm-hmm. Yeah. And then I wasn't sure what Beverly meant by protecting him medically.
Right.
But I know that sometimes adult children are very worried about the work that they see one of their parents doing, caring for another one. And I think that can be especially hard when you see your parent caring for a spouse who's not your biological parent, right? I mean, they've been married 20 years, but he's also, he's potentially like in his 80s. And, so this person came, relatively late in terms of the rest of you for family. And so it can be really, really hard to see that. And I would say that it's I would encourage, again, kind of approaching him from a space of curiosity and trying to better understand how he feels about it and what's most important to him. And often we want our parent to take better care of themselves than they want for themselves. And so sometimes framing the suggestions that you have for him to take care of himself, the more you better understand what's important to him, and often this may or may not be the case for him, but often for the caregiving spouse, what's really important is that they take care of their spouse, actually. They're more concerned about that than their own health. So sometimes framing it as this will make it possible for the two of you to keep living at home, which I know is really important for you. But often the messaging that you got to take care of yourself, you got to take care of yourself, we find is not very successful. But yeah, managing the kind of the dynamic between them is often super challenging.
Yeah.
Okay. Thanks for the question. Good luck with that situation. It's definitely challenging.
Mhm.
Okay. Melinda asked a question that is a very common question, a great question. How do I know when it's time for memory care for my aging parents? So, Melinda, I am wondering, first of all, is your parent currently living at home or already in a facility? So it's helpful for us to know kind of, when you're contemplating this shift to memory care, it's a shift from where? But Michelle, maybe you can talk a little bit about memory care and how you think about that with the families you work with. When does it
Yeah.
seem like it's a good time for memory care versus other alternatives?
Right. And I think that's what's good to first understand is like what the landscape of options usually look like. So when we're looking at community care, so moving into some sort of community or facility to get care, you can think of like those big assisted living communities that sometimes have a memory care unit within them, sometimes they don't, or sometimes there's standalone memory care communities that the whole place is just like only for residents with memory care issues. And a memory care usually has different regulations than assisted living communities. They are usually required to be locked so that the residents cannot exit the building very easily and can't wander off and get lost without, they can't leave the building without somebody knowing about it and letting them out. So the facilities are usually locked if it's a memory care. They also usually have a more robust staffing situation than an assisted living community. So you might have, one caregiver to six staff instead of one caregiver to 10. Wait, I didn't say that right. One caregiver to six residents instead of one caregiver to like 10 or 11 residents. So usually there's more robust staffing. The activities are usually geared more towards people that have memory impairment. And the caregiver approach is usually different in memory care than it is in just regular assisted living. So in memory care, the staff is used to, sometimes I describe it as the staff is more used to doing things to the resident instead of like asking the resident if they want to do something. So they're like, okay, it's time to take a shower. Let's get in the shower. Instead of, hey, today's your shower day. Do you want to shower today? So in the assisted living side, residents usually have more choice or more on their own to voluntarily participate in activities and participate in their care and memory care, the caregivers are taking a more directive approach, bringing people out to all the meals, bringing them out to the community social activities, making sure they are getting a shower and making sure they are taking their medications, making sure that they're just working with them in a more directive way. So I would say that it's time for memory care. The first big red flags that somebody needs memory care is if they're a wonder risk, right? So like if your parent is at risk for walking right out the front door and heading down the highway, that's a pretty good sign that they're ready for a memory care. If they're having behavioral issues, so sometimes people with memory and thinking problems have a hard time regulating their emotions or dealing with their frustrations in a constructive way, or sometimes we don't really know what's going on, but they might have behavior issues and they might be fighting with other residents or throwing things or acting in ways that is not okay in an assisted living setting. And so sometimes it's time to move to memory care if there are behavioral issues, like lots of yelling or screaming or crying. Um, so that's the other reason why people move to memory care. But I say that there's also a good reason for people to move to memory care just when they need that extra level of support. So if the assisted living is, let's assume that Melinda, your parent, is living in the assisted living section of a big community. If they're just not getting the care that they need because the staff isn't taking the right approach with them, or they need more oversight, more supervision, sometimes you can get that in the memory care area as opposed to in the assisted living. Now, if you're moving from home into either assisted living or memory care, like that's a whole different set of questions because you're moving from home. It can often be a little too disruptive to move straight from home into a memory care setting. And so oftentimes we move from home into assisted living, knowing that at some point we might need to transition into memory care. But not everybody who has dementia needs to live in a memory care center. A lot of people who have dementia can live out their life just in assisted living.
Yeah. And we also have some families, I mean, I can think of one particular family in the membership whose aging parent has dementia, very, very poor memory, but pretty mobile and talkative. And they considered memory care because the mother wasn't doing that well in assisted living. She wasn't coming out enough, and she would get very confused when she was out, even after being there for over a year. But what they ended up doing is they ended up hiring neighbors to be a companion, to go in for 4 hours every day to help get the mom out of bed, because otherwise she wasn't getting out of bed, help get her dressed, help bring her to lunch, and help bring her to a few activities. And the cost is about the same as moving to memory care, but they feel like it's a better fit. So there are also sort of, you know, I think the first question is, how do you know when it's time to change the care setup for your aging parent, right? And that's when they really seem to be lacking something, a level of care and supports. When you haven't been able to find a way to get them the care and support and assistance that you want in the current setup, it's like, okay, we got to change something. And then switching to memory care is one option, but there might be other options. And so, yeah, if we were on one of the members' calls and you were unmuted, we would talk more about like, what are you seeing? What's the concern, right? What's the kind of like issue that you're trying to work around? And then what are options for meeting that need? That's really kind of what it comes down to. What seems to be the unmet need? And then what are our options for meeting that need? But yeah, it's a super common question. And in general, often a struggle for people is, you know, when is it time to change something? And then how do we do it?
And sometimes I think it's worth asking the memory care that you're considering. I think it's worth asking them if they have an adult day program.
Mm-hmm.
Sometimes that's a good way for a potential resident to try out the memory care, is to go there from 10 to 3 or 10 to 4 every day and see how it goes.
Yeah. And it also just provides them with a structured set of activities, that can be really good for them. Adult day programs are also really great for people who live at home and have memory problems as well, as a way to get them out of the house into an environment that, is structured and set up for people like them, right?
Mhm.
Yeah. Okay, great question. Okay, Krazan said, how best to determine if a parent has a way to receive weekly in-home care from a medical professional caregiver? Trying to keep a parent in their home rather than a care facility without a huge financial outlay. So, in the interest of continuing with other questions, what I would say is take a look at that video we did on the how to pay for elder care, because in it, Michelle goes through the kind of different like options for providing care and the usual options for funding them, and different sources. I also don't know. Do you think it's helpful, Michelle, the website? There's like a benefits checkup website, right? Does that help with that kind of question? I can't remember.
The benefits checkup website is fantastic, but it's very broad, and so it's going to bring up all kinds of um, potential supports that aren't not like caregiver specific.
Yeah. I think in the video we made, if I remember right, just very briefly, what you had said, Michelle, is I think you had said that options are potentially Medicaid, if you're on it,
Mhm.
um, VA, potentially long-term care.
Mhm.
Is there another one I'm missing?
And it's private pay.
Yeah, it's often families just paying. Yeah.
Yeah.
So, okay. Yeah, but it's a good question and it's an important issue.
Yeah.
Um, Rosemary said, how do I support an aging parent who has high needs for support but refuses to accept help from anyone outside the family? My sibling and I are stretched beyond capacity to provide the needed care. So yeah, this is a really this is a really common situation that we see. Some aging parents are refusing help from anyone, including their adult children, and then there are others who will take it from their adult children, but from no one else, and you can end up after a while completely exhausted and stretched beyond capacity. So, Michelle, yeah, what are some ideas for this situation?
And I think like some of our previous questions, I think it's important to know if the person has any memory or thinking problems, right? Because if she does not have memory and thinking problems and she's just if there are no memory or thinking problems involved, then I think we need to think about some family meetings, elder care mediation services, like some ways to sit down and talk together about the barriers and about the boundaries and about what you're able to do and not able to do. And sometimes it's okay to let our parents make a bad decision and let them suffer the consequences of that, right? Like, Mom, I can come here on Sunday and help you with dinner, but if you need more help than that, like we're gonna need to hire somebody because and let her make those decisions if she doesn't have memory and thinking problems. Now, if there is memory and thinking problems, she does have some kind of dementia, or if this is dad, then we have to start thinking maybe about using a fiblet, right? Like, Mom, this is my best friend from college, and you know, she's here in town for a few weeks needing some extra work. I'm gonna have her come over to your house. Like, make it some way, like, make it a very personal, like, this is an extension of me who's gonna come over and be with you. So even if you have to start using some fiblets, you could also think about hiring a geriatric care manager or an aging life care professional like myself, somebody who can help to like start building a new relationship and rapport with your parent in a different way than maybe a caregiver can, somebody that they can bond with, and then that person can start introducing in um, some more caregiver support and help you to start navigate through that. Um, so I think we would need to know a little bit more um, about the situation and about kind of what your parent is dealing with.
Yeah.
My, those are some of my thoughts.
hmm Yeah, and it often does take, no matter which route you go, It takes a lot of persisting and working at it.
Mm.
There's usually no like easy, simple thing that makes them accept help or change what they're doing very quickly. You know, if she doesn't have significant memory and thinking problems, and you go the route of negotiating and setting boundaries, people are often like, they didn't respect my boundaries. And they often don't. They will often test them right away because people are used to getting a certain level of assistance or support or are used to interacting in a certain way. And I think it's totally legitimate to make the decision to actually take care of yourself a bit. It is really important to sustain yourself so that you can be present, at least in some form, for however long this takes, ideally. And that's part of how you can justify pulling back a bit. But it's fairly rare for aging parents to initially be like, oh, okay, we'll just do it differently. It does take a while for people to adjust to different ways things are going to be done.
So
So,
Rosemary responded that mom is 90 with mild cognitive impairment and delusional disorder.
yeah,
And so that
yeah,
make things like very difficult. But I would think about looking for an aging life care professional, somebody who does geriatric care management in the area to add on to your team to start navigating through this.
yeah. I would also say, I don't know how long she's had delusional disorder. Um, But at 90, I mean, a lot of people, and especially in the membership where I can talk more to people and they can tell me exactly like what kinds of symptoms their parents are having. A lot of older adults have a diagnosis of mild cognitive impairment when really they qualify for dementia. Because part of the difference between the two is are the difficulties with memory and thinking significantly enough to impair independence and daily life function? And often that's the case. And delusions are extremely common in Alzheimer's and in various other forms of dementia. It's true there are forms of delusional disorder that exist as like mental illnesses that affect people earlier in life. And the reason why I bring that up is that sometimes it helps people. One of the things that families sometimes, often actually have to learn to do is to start fudging the truth. There are a couple of things people often end up having to learn to do when they're dealing with Alzheimer's or another form of dementia. One is fudging the truth, not always telling the truth. Sometimes even telling, what we call a therapeutic lie, a fiblet, something that's not quite true in the interest of facilitating some aspect of the care that's really important to people. They also often have to learn to stop asking the person's permission for things, so just as Michelle was saying, that in assisted living, they'll be like, do you want to take a shower? And in memory care, it's like, it's time for your shower. Sometimes it's necessary to offer fewer choices. And that is sometimes how we change up the care, to get them more care they need, or maybe get an adult child out of a situation that is no longer sustainable for them. And sometimes people, it's realizing that it's no longer just mild cognitive impairment, but something a little bit further that allows people to feel like they can take those steps, which are still very hard. It's very hard for most people to not tell entirely the truth, right? Or allow their parents to make decisions. We want to respect their autonomy and their opinions. And sometimes it does get to the point where what makes things work is to join them where they are and realize that they're not able to understand the situation completely and to sort of step in a little bit more. So that's part of the journey as well, I think, is realizing where are you in this and are things at a stage where it might be actually appropriate to start maybe not telling 100% the truth or sometimes overriding things. Because in a lot of cases, people do reach that point, if they're dealing with memory and thinking problems. Okay, thanks for the question, Rosemary. Um, Richard asks, what is the best way to remind MCI individual without using the word remember? Okay. So It's true that if people are having difficulty with their memory and thinking, it's often counterproductive to be telling them, "Don't you remember this?" You know, "Don't you remember this?" It tends to put them on the spot. It leaves them feeling embarrassed, and that discomfort and stress that they feel uh, makes it even harder for their brain to work at the best level it can. Generally, the more relaxed, confident, and otherwise positive people feel, the better their memory will be. So this is a great question, Richard. It's great that you have are being attentive to this, and realizing that it might not be helpful to be saying remember. Um, I guess some of what I'm wondering about is what are you hoping to remind them of right now? Um, any other sort of questions or thoughts you would have about this, Michelle?
Yeah, I think it's like what task are we trying to achieve? Is it like remembering p who people are or dates? But I would start thinking about what are some memory tools that we can put in place, like big calendars, using medica automated medication dispensers, um, using sticky notes. Carol introduced us to something called Memory Board, which is, just a screen that you can send messages to that will pop up for your older person or your person with mild cognitive impairment to look
Mm-hmm.
at so they can be reminded of what's happening today. So it's like 9 o'clock, I'm picking you up for, our trip to whatever. Um, so there's all these tools that you can start to use, like memory board or post-it, big calendars, medication dispensers, those kinds of things.
Yeah. Now, I don't know if this is what Richard is getting at, but I know that sometimes when an older person's memory starts slipping, family around them really they want to help them remember the grandchildren or where they are or different like facts. And there's this idea that it's going to help them hang on to, their cognition more. And I would say that it probably doesn't help them hang on to their cognition more, right? So if they don't remember someone's name, it's not useful to be prompting them and giving them exercises so that they get better at reminding them. It is if it's in a conversation, right there, it's gracefully stepping in, and here's so and so, this person from this. Stepping in. If they don't seem to remember, you just kind of step in rather than because I think I've seen families almost feel like, well, if we just drill them, that's going to help their memory. Um, and it's an understandable idea, except it doesn't work.
Hmm.
It doesn't work. So uh, please don't feel like you need to reorient them to reality or the important things to remember because that's going to be good for their brain. It doesn't help with this particular process. And I think, as Michelle was saying, really focusing on how do we provide the cognitive supports, reminders, prompts to enable them to be doing the things they want to be doing or that they need to do or socializing and participating in life the way they want to and to minimize their discomfort and embarrassment. That is the focus. It's not so much it's not like drilling people on the multiplication table when they're kids. know? Um, that is not the idea. The other thing is if people are having like a lot of like generally in mild cognitive impairment, people are slower and it's an effort, but they can still do things. If they're having a lot of difficulty remembering things, then I start to think to myself, is this really mild cognitive impairment? So that would be the other, thing uh, in my head that I think about with that question.
Yeah.
Um, okay. Um, Anonymous asks, how do we know when the right time is to move in with an aging parent to provide assistance while respecting their need for independence and autonomy? Um, okay. Well, I'll tell you the things that I initially think about, and then I would love to hear from Michelle's take on this also. Um, One thing I always think about with this question is, again, what have the conversations been like to really understand what the parent's perspective is on the situation, their need for assistance. What do they feel they need help with? When were they thinking that they might need more assistance? What did they have in mind as potential solutions to what sounds like it is common for families to feel like an older person needs assistance and the older person to not feel the same way. This sometimes reflects a memory and thinking problem. This sometimes reflects different priorities. Um, this sometimes reflects a combination of the two, like the older person being starting to get a little cognitively fuzzier, and also underestimating a little bit the risks, and also just feeling like this is really important to me, and yeah, I could fall and break my hip. You know, I'd rather have my independence. That's how some of them feel about it. So, so one is I think you know, it's important to have had these conversations to really understand both their perspective on it and also their level of cognition and insight into it. And I do cover addressing both of those aspects in the first part of my book, which is called Taking Stock, kind of assessing the situation, what you're dealing with, and your parents' perspective on it. What are the other options, that might exist for providing assistance? How does your parent feel about it? And then I will say that moving in is an option, and people often find that it's really, really, really tiring. Really, really tiring. So, you know, how how to have it be sort of successful and sustainable is another question as well. But those were my initial thoughts. What are your thoughts, Michelle?
Yeah, I definitely echo everything you're saying, especially about it being sustainable and successful. Like, is it too early? Like, you don't want to do it too soon and just be filled with conflict and it be a very difficult time for everybody. And then, of course, like the dementia progression, what could take 3 years, 5 years, 7 years, 10 years, 12 years, 15 years. I mean, it could be a very, very long journey. So you do want to do something that is sustainable. I would say that you might know that the person needs more support. One of the options being having a loved one move in with them. Um, when you can tell that they're having troubles like keeping up with their medications, they're not remembering to take care of themselves, their clothes are going unwashed, they're not eating appropriately, they're staying more isolated. All these things are happening are going to be the red flags that something needs to change. And one of the options might be for a loved one to move in with them. But just like you said, Dr. Kernisan, like having that larger conversation about like what's important to you, what do you understand as the options, how can we move to a place of getting you some more support?
Yeah. And I want to say also that, yes, it is common for families to move in with an older parent or maybe move them in to your own home, especially when there's dementia or Alzheimer's. But sometimes it's not that. Sometimes there are physical health issues that are limiting the person. And people move in to provide support with that. And that, again, can go on for years. I definitely know families who thought they were signing up for something that was going to last 6 to 12 months and found themselves kind of worn out 4 or 5 years later. So my other thought too is that when people are considering this kind of moving in, is to also consider, can you very early on set up just your own time aside and maybe having some other sources of support for your parents along with you, so that you're not like the only thing it's for a few years and then trying to bring in something else that might help your parents. Because I know we've seen some people who, they move in, but they also get some help from someone else, taking their parent out to do something, and that kind of diversifies and it makes it more sustainable to be in that role for years and years.
Mhm.
Okay. Deborah said, my dad has recently been diagnosed with Alzheimer's and deep vein dementia. Okay. Mostly his short-term memory has been affected. I also notice it takes him a long time to do things like a computer going very slow. He says there's nothing wrong with him, thinks he's been scammed. In regards to restricted driving conditions, he thinks dementia is something embarrassing and means you're less of a person. I don't know what to do to get him to understand he has had changes and it's okay to get help or join a support group. He won't tell anyone. So I've had to contact some of his closest friends to update them. If you didn't know him, you would not know he was having memory issues. He's verbose and friendly, but his recall is not accurate and thinking he has been scammed is a constant challenge. It was a CT scan that diagnosed his condition. He also had an in-depth cognitive test. Do I let things progress naturally or try to work with him to understand that things have changed? Okay, good question. So, deep vein dementia, I think maybe what you're referring to would be like vascular dementia, um, which is and it's very common actually in older adults if they develop dementia. So the difference between dementia and Alzheimer's is that dementia is the syndrome of having developed permanent changes to your brain that affect memory and thinking to the point that you've lost independence in daily life activities. And then the question is, well, what changed your brain cells to cause that damage? Alzheimer's is the most common underlying cause. But another common cause is damage to the small blood vessels that are deep in the brain. And that tends to cause vascular dementia. And what we know is actually once people are in their 80s, it is extremely uncommon for them to have a single underlying cause of dementia if their brains are biopsied and sampled, which usually happens at autopsy occasionally while they are alive, but it's unusual to be having a procedure that causes that. Then we find, multiple underlying causes. And that combination of Alzheimer's and vascular dementia is very, very common. For those of you who want to learn more about types of dementia, I have a video on the Better Health While Aging YouTube channel that goes into that, and also an article on the Better Health While Aging website. Um, so his combination is very common. Um, and the symptoms you describe are common as well. It's also common for people to be very embarrassed about this or have difficulty accepting it for various reasons. And so I guess what I would say is that I think when people have developed dementia, it is important to offer them a chance to hear about the diagnosis, to ask questions, to participate in it. And then after that, do we have to keep on reminding them or insisting that they understand? And I would say generally no, actually, because ultimately the question is, is this helpful, right? How is this helping? And in people like your dad, it's often not helpful. It's also not productive. So usually if they're not receptive to it, um, it's not going to be possible to explain it in a way that they get it. So generally what things that can sometimes help is I do a lot of normalizing. When they're having some difficulty with the memory, say, that's really common in people your age. Happens to lots and lots of people. I might fudge the truth there. Say it happens to most people. It's not necessarily true. Doesn't matter because I'm there to say something that helps them feel better, right? And I'm trying to see, can we like acknowledge the memory difficulties without making a big deal of it or leaving the person feeling really bad and normalizing it as something that happens to lots of people and not necessarily a big deal is potentially one way to do this. Creating a little space to say something like, you know, this must be hard for you, and just see what they say, right? Sometimes we're in the mode of explaining, trying to get them to understand. That crowds out a time when we could just offer an expression of empathy and sort of see what they come out with there, you know? And he might deny it. He might say, yes, it's so embarrassing, right? And then we want to be careful to not argue with that. Well, no, it's not embarrassing. Lots of people have it. Just be like, I'm sorry, I would find it hard also, right? There's some sort of like things we can potentially say. So those are my initial thoughts, is that it's good to give him an opportunity to know about it. And it sounds like you've done that. And I don't know that you have to push to get him to understand. Any thoughts you want to add, Michelle?
It's so difficult. And Deborah, my
Mhm.
heart just goes out to you. I mean, I'm picturing all the clients that I have who are sort of stuck in this phase of the dementia as well, and just how painful and difficult it is. Because dementia on its own, right? Like the loss of memory and the ability to think is a very difficult thing to journey alongside with somebody through. But you add on top of that their inability to see that they have any impairments or that they're having any brain changes, and them fighting with you about it just is also like adds to the stress and the pain of it all. So I'm just so sorry. But I agree. I think what Dr. Kernisan is saying is exactly right. Like we can't really reason with people who are losing the ability to be rational. So, I what I try to do with clients who are sort of stuck in that phase is to just stay really focused on like what are the tasks that we need to get done together, right? Like, has your dad filled out a power of attorney? Has he done an advance directive? Like, do you know about all of his important assets and accounts, and like are you positioning yourself like in a way that you can step in as his faculties continue to decline. So sometimes I think like staying focused on those like task oriented things can help you get through some of these really difficult parts. um but I don't know if we can ever. I don't think it's ever helpful to keep going back over. Well, we're here because you have dementia. We're doing this. You're not able to drive because you have dementia. Or don't you remember the CT scan that you had? Don't you remember what the doctor said to you? Like just try to align and say like I'm really sorry that all this is happening. It's not fair to you. And this is really difficult. And then just try to keep yourself focused on like what are the things that you need to be getting done with him.
So, Michelle, and so then when you're trying to get them to let you help them with a task, right? And you have to help them because they do have this dementia. Can you just give some examples of how you work around explaining why you're starting to help them with their finances or their,
I know. I
yeah.
try to we try really quickly, right, to do things like to start moving things. Like for instance, if your dad is like not managing the mail very, very well, it's like how can we start just changing everything over to, electronic notices and have it go to an email account that you can access? Or how do we start like getting things like out of sight, out of mind so that you can start taking over? How do you start like snooping around and like figuring out you know, the things that he owns or like the bills that he needs to be paying and those kinds of things? How do we make sure we know what the medication list is and like how he's doing the meds, and don't really ask for permission, but just start doing it? Or how, like I've brought up medication several times, but that's one of like the early things that you need to start taking care of as a caregiver. And sometimes I'm like, oh, look, your primary care doctor like just set up this really awesome dispenser and shipped it to you. Like, look at this thing. It already has preloaded with all of your medication. So like start figuring out ways that you can use fiblets to start introducing some new interventions.
Yeah. I think I've heard you say also, Michelle, that you often you just do something and then you play dumb and apologize.
Yeah. Oh, I'm so sorry.
Yeah.
Oh, we talked about that. I didn't know. Or
Uh-huh.
pretend like the things came from somewhere else. Like, oh, somebody else must have shipped you this giant calendar that we can put on your on your kitchen wall. Like, let's hang it up and start putting down your appointments.
Or it's a new freebie from,
Yeah,
Medicare,
yeah.
right? Or from your doctor. Oh, your doctor is doing this with all their patients.
Mhm.
That's something I tell people when I do the cognitive testing, actually, is I tell them I do this on all my patients. It's not necessarily true. It doesn't matter, right?
Yeah.
Because I just need some kind of story that makes it palatable to them.
Yeah.
You know, I don't need them to like understand like 100% of the truth. Um, so hopefully that's helpful, Deborah. But yeah, it's hard and it's a whole process. Like starting to experiment with these other ways of interacting with him and figuring out how you can support him at this stage. Um, okay. So, Anonymous said, if people are familiar with scheduling an annual physical before turning 65, that changes when they turn 65. Is the only option then a wellness visit, or can they schedule an appointment with a geriatrician like you or a specialist like Michelle? What kind of care should patients get? Should they skip the wellness visit and just schedule an appointment with a geriatrician or specialist? Thank you. Okay. So 65 is very young for a geriatrician, actually. Um, uh, the the thing about seeing geriatricians is that there are relatively few of us, less than 7,000, practicing in the United States. I forget what it is, but I think there's like one of us for every 10,000 people or something like that. Um, so part of why I do better health while aging is because I feel like that the geriatric principles of care need to, should be incorporated into people's healthcare when they're in their late 60s, 70s, 80s, but most people are not necessarily going to see a geriatrician. You can look and see if it's available. The wellness visit does, cover lots of stuff that could be useful, but some of the things that I think can be helpful myself is instead of looking for a geriatrician specifically, it's to consider. They used to call them senior health clinics. There are some primary care clinics that are specifically set up for older adults. And they often have kind of processes in place to follow up after falls, to assist if a person is having memory or thinking problems. They're just kind of designed more for people who are in their last few decades of life, and I think that can be helpful. So I recommend looking for those. They sometimes exist at medical schools. And then Michelle, maybe you can speak to how people can see somebody like you.
And then in order to get to a geriatric care manager, most of us are members of an organization called the Aging Life Care Association. And on there, on our website, on the Aging Life Care Association's website, there's a little button that says find a professional, and you can click on that and search your zip code or your parent zip code to find somebody like me. And then there's also social workers spread all throughout our medical, our healthcare systems. And so maybe there's a social worker or a nurse care navigator within your systems that you can get to as well.
Yeah. But in general, there tends to be not great primary care addressing this outside certain special settings. Now, for older adults who have declined quite a lot and might even be eligible for nursing home care, there is PACE, Program of All-Inclusive Care for the Elderly. Those are special clinics that are available mostly in metro areas, where you use your Medicare money and also your Medicaid money. If you're not on Medicaid, you can pay usually a few $1,000s to cover the difference. And you get kind of comprehensive care from a team that is specially trained to care for frail older adults. They're great. Those teams may have geriatricians, but even if they don't have a geriatrician, the whole team, there's a pharmacist, there's physical therapy, there's nursing. They're very they're trained and set up to provide good care to frail older adults, but that's usually for older adults who are frailer and might even be sort of approaching eligibility for nursing homes, which means that they're dependent. Usually, in they need assistance with like two activities of daily living, right? Yeah, but um, an option for some people. Okay, so we've been going for a while. So I think we're going to do questions for another like 5, 7 minutes because I want to respect everybody's time, especially Michelle and Carol's. So let me say. So Julie said, "How to manage when a sibling disagrees over the parent's capabilities and conditions. Sibling who lives close by, 1 hour, overlooks needs, and the sibling further away." 1,200 miles visits and works hard to support the parent on issues of day-to-day living. It's exhausting for the sibling who lives further away and cannot see the parent as often. Yeah, Michelle, I'll let you take the lead on this one.
I find that
Sibling dynamics.
yeah, that's a pretty similar dynamic where like the two adult children aren't really assessing or seeing the parent's situation in the same way. Um, I would say let's start with like who has your parent designated to be their healthcare decision maker or their healthcare agent and financial agent? Like, in other words, who has your parent chosen to be the one to step in and do the help and support as sort of the leader and the decision maker? Because maybe if they've allowed the sibling who's closer to be that one, maybe we just let them maybe we just let that sibling manage things the way that they think is best, as long as they're not exploiting or neglecting or abusing the older parent. Maybe sometimes we just step back and say it's not the way I would have done it, but this is who they chose to be in charge of the things, and this is how they're doing it, and maybe it's just fine. I'll see if I can help and support in some ways. But then we have to start assessing whether or not there is some abuse, neglect, or exploitation. Oftentimes, I see that when there's an adult child who's ignoring all the red flags, who is not really wanting to see all the difficulties that they're having, sometimes I can see that there's some secondary gain that that adult child is getting, right? Like the parent is helping to support them. Maybe they're living together. Maybe there's um, some other thing that the adult child who's ignoring all the issues is gaining from it. Or maybe sometimes they just don't want to be bothered and they are ignoring it that way. And so, you start figuring out like, do I just start intervening and start doing the things that my parent needs, putting things in place for them despite my siblings' willingness to agree or participate? Maybe we just start acting and doing things for the parent that don't involve the sibling and just let them know what's going on. But it is very, very typical to have this kind of dynamic. I think elder care attorneys can help, elder care mediators can help, geriatric care managers are another option for some professional support that you can get involved in the support team to start navigating through this. But it's very exhausting and very painful.
Yeah. I was actually thinking about that, the care manager option, that sometimes hiring a care manager to do an assessment
Mhm.
of the how the aging parent is doing and their needs. And then having that care manager do like a meeting with the siblings, because then you have like a, a third party, who has some expertise in assessing needs and can sort of speak that to the sibling who's closer, and then maybe facilitate a negotiation of like, well, how are we going to, you know, uh, meet these needs? And if the sibling isn't, who's closer isn't willing or able to step in hands on as much, are there other ways that they can contribute? Maybe help pay for a caregiver, or, there might be some other ways. But I think it can be helpful to families to have a third party professional. And it's really the care managers who are going to be best at assessing needs. Like, what does this person need in terms of like the care? Whereas I think the attorney and the mediator, elder care mediators, aren't going to have that expertise and ability, right?
Yeah, that's true. And one thing I'll say too is that we can't force our siblings to participate or do more for our parents than they're willing or able to do. And sometimes we just have to get over that and move on, right? Do the best we can, put some interventions in place, and maybe we don't get the support. Most families, I would say, don't get the support from their siblings the way that they would have expected or hoped to get.
Yeah, yeah, it's true. All right, so this is going to be our last question. Um, Mom, Anonymous said, Mom, 77, was fully tested and diagnosed with mild cognitive impairment with likelihood of progressing to dementia or Alzheimer's. She has knee osteoarthritis and will be needing knee replacement surgery soon. We heard there's a possibility that her memory can decline more with surgery. Is this true? Um, so the answer is yes. Surgery, there is the possibility anytime an older person has surgery, especially if they have general anesthesia or if they have a hospitalization and are very sick, um, there is the possibility that the stress of the hospitalization and surgery or other illness, if they're hospitalized for another illness, will provoke something that's called delirium. So that's a state of worse than usual mental function that comes on sometimes after surgery or when people are very sick. Or sometimes, if they already have Alzheimer's, it can be relatively minor things that can cause delirium. Even in some cases, a urinary tract infection, a pneumonia can cause delirium, or even a medication side effect. So when people have delirium, especially during hospitalization or after surgeries, it is associated with an acceleration in their cognitive decline. So there is a potential risk, of accelerating a dementia process when a surgery happens or a hospitalization happens. On the flip side, um, given that that doesn't mean that we want to avoid all surgeries, right? I think it just means we want to be really careful and mindful, which is what you're doing. Your mom is 77. I don't know what her health is like otherwise, but and if she has mild cognitive impairment at 77, I mean, she could easily live another 10 years, if her health is otherwise okay. And if her knee is so bad that they're considering a knee replacement, that usually means that she's having a lot of pain, and that usually means that her mobility is limited. So she could benefit quite a lot from having the knee replacement. I'm assuming that she'd be able to participate in the rehabilitation afterwards. And that can be hard to do when people are further along with their dementia, but if it's just mild cognitive impairment, she might be able to. And you can take steps to reduce the risk of delirium associated with the surgery. So you can talk to the surgeons and let them know that you're really concerned about that. Um, I know somebody, I'm not sure what they're doing right now for knee replacements. I was hearing from somebody who's going to have a hip replacement soon, but sometimes they're able to do these with spinal anesthesia instead of general anesthesia and a little light sedation. Some hospitals have actual like special teams focused on delirium prevention, or they have special units for hospitalizing older adults to reduce delirium, where they get woken up less during the night. Um, they get like mobilized sooner. There are sort of, I'm going to be sending it out, I think, this weekend, the Better Health While Aging article on hospital delirium. But there are like things that can be done to help reduce the chance of delirium ahead of time. And some hospitals are, actually have special programs designed for that. So I would recommend bringing it up with the surgeon and just asking, letting them know that that's a real, that that's important to you, right? And what are things that the surgeon can do or that the hospital can offer to reduce that risk? Because I do think it sounds like she's one of those people who could potentially like benefit from it, right? If she's otherwise in good health, she'll live, a while afterwards, and that this could make a difference in her being able to continue walking and remaining mobile. And there are a lot of advantages to her having more mobility, as she advances with her dementia.
Yeah. And I just want to say I'm glad that you're asking this question, and it's been my experience. I think I've been through 3 or 4 surgeries with clients this year that the surgeons and the anesthesiologists both like sort of dismiss this idea that surgery is difficult on older adults, especially those who have memory issues, which I think is really strange because it's not our lived experience, right? But in all, I don't remember, it was 3 or 4, but on all of those surgeries, we were successful at getting the anesthesiologist to agree to doing a spinal instead of a general, and then using
Mm-hmm.
sedation. And the clients, I mean, that my anecdotal experience is that they all did really well with it, and the anesthesiologists were very open to just to doing the spinal.
Yeah. So it is one of those things where, asking extra questions or for what might help. But yes, the general anesthesia where they kind of like put you completely out is usually a bigger risk for delirium afterwards and for affecting cognition. Whereas spinal anesthesia is kind of similar to like the epidural that women get during childbirth, right? So there's a lot less impact on the brain, and that would be an option as well. So good question. Okay. Well, there are more questions, but I am going to wrap this up because I want to make sure to respect everybody's time. Let me quickly see if I can go back to the uh, these slides. All right. So I do want to thank everybody for coming. And thank you also if you were among the people who, again, told me a little bit about your challenges with your aging parents. That was like really helpful. It gave me ideas for things that uh, videos and topics that we could cover on the new YouTube channel. Thank you also if you let us know that the videos and articles have been helpful to you. That's always like really nice to know also. Um, and if you would otherwise like to support this work, I will say this has been a hard time the year right now for content creators. So I just want to throw out a few options. I plan to keep doing this as long as I can. And if you are there with an aging parent, I would love for you to consider the Helping Older Parents membership if you would like more of this type of ongoing support from me and Michelle. We do need to have enough members to be able to continue offering it. So if you're caring for an older loved one it's financially feasible, I hope you'll consider it. You can try it for 30 days and back out if it's not a good fit. But otherwise, just subscribing and sharing the content. So I think many of you are on the email list for Better Health While Aging. If not, if you go to the website, there should be some sign up boxes. You can also subscribe to the YouTube channels. There is the newer one right now, which focuses on caregiving and dementia, the Helping Older Parents channel. And then there is the original one, Better Health While Aging, which is now going to focus mostly on aging health um, topics. Like I'm working on one right now for incontinence. So if you're caring for an aging parent, I think both channels are going to be helpful to you. But we do have a lot of older adults following the main channel who don't particularly want the caregiving content, and that's part of why I spun off the other channel so we can speak to some of the specific issues that are coming up for people in your situation. You can also become a supporting member of the Better Health While Aging YouTube channel. It's the main channel right now that has a membership, not the Helping Older Parents one. If you like, and all of that helps out. And if none of that is feasible or of interest for you, that's fine. Just come to the free things. There will always be like free articles, free videos, and we're going to try to do a few more of these aging parent QAs this year because they are fun for us, and it's a special treat for me to be able to answer questions with Michelle. And so with that, I'm going to wrap up today's call. So thank you again. Thank you for being here. And especially thank you for everything you are doing to help your older parent or older loved one, whoever that is in your life. We could not do what we do without collaborating with families and care circles. So I'll be sending out the replay later tonight. Thank you, everyone. And have a great rest of your evening. Thank you again so much, Michelle, for being here, and Carol as well. Okay, bye, everybody.
Bye.